Sharma. I am a consultant dermatologist practicing in Delhi. Friends, today we will be discussing few points about a very common skin disease which has flooded our OPDs in the recent past, that is fungal infection or tinea. As all of us are aware, we are getting many unusual cases of tinea in our OPDs. The patients present to us with unusually large lesions, multiple site infections, some corticosteroid modified lesions, and also the disease has become chronic in many patients. So it has become a challenge for the treating dermatologist as well. So how do we deal with such patients? Apart from the usual treatment which we give in the form of oral as well as topical antifungals, an important point in the treatment of such patients is the counseling of these patients. So we need to spend some time and counsel such patients properly. First and foremost point in the counseling is compliance and adherence to the treatment. The patient should religiously follow the treatment given by the consultant dermatologist. He should apply his creams properly, and an important point here to mention is that the cream should be applied 2 cm beyond the active margin of the disease, and he should continuously use the creams even after the clearance of the lesion. The patient should continue to apply creams 2 weeks beyond the clinical cure of the disease. Also, the important points, the things which the patient should avoid is they should avoid wearing tight clothes, especially tight jeans, denims, jeggings, leggings, as well as tight undergarments, which is quite common with the youngster these days. They should avoid sharing of clothes amongst their friends as well as family members, and they should avoid sharing of bed linen, towel, soaps amongst the family members. The clothes of the affected person should be washed separately and should not be dumped in the same machine along with the clothes of the persons who are not affected. It should be washed separately, dried in the sun, ironed before wearing. Also, undergarments, socks, caps, they should be properly, regularly cleaned as well as dried in the sun, and it's important if they wash the clothes in hot water. And also the patient should avoid heavy exercises which leads to excessive sweating, and they should keep their body dry, avoid getting wet in rain. Also, the nails should be trimmed regularly because they can also act as a reservoir of infection. All the household contacts, if they are affected, they should be treated. So we should keep all the clothes of the affected members separately. And also the patient should be instructed not to use the steroid based creams or over the counter creams which are easily available in the market, and they should religiously follow the prescription which is given by the consulting dermatologist. Also, special care should be taken if the patient is diabetic or immunocompromised, because they tend to have severe infections and the disease becomes chronic in such patients. So I hope all these tips would be helpful for you in treating your fungal infection patients properly. Thank you.